I'm talking to Tom Goodwin, the Godwin.
Yeah.
As I said, the name that he was called in the emergency ward at, was that Toronto General? Where was it? Where were you at that?
You mean,
When you went in for your x-rays?
oh, it was at, I was at the Sick Children's Hospital.
Oh, Sick Children's, that's right,
Yeah.
because you were mad because your Dad's friend was a
Yeah,
pediatrician instead of a big person's doctor.
Yes, yeah, that's right.
Dr. Tom Godwin, and he's written a book called A Doctor's Notes. The little bit I am embarrassed. Historically, I never interviewed an author without having read the book. I got a chance to read a bit of the book, and I've heard so many stories about this man from David Hancock and way back when, another man named Tom DeRoos, and it's fascinating. Because you ended up, if I'm not mistaken, you ended up going into coronary medicine, and you had the first coronary clinic in Canada, or the first coronary,
I don't know.
Toronto General Hospital or something, or where were you? That 1962, I've got someplace I read, I can't remember if it was on the internet or where.
Yeah, in 1962, I was working at the Toronto General.
That's what I thought, Toronto General
Hospital.
How am I doing here, by the way?
Yeah.
From, you know, and this is...
I was a lowly junior intern, you know.
Yeah.
Hospitals have hierarchies, and when you're a junior intern at the Toronto General, certainly back then, you were at the lowest end of the totem pole. But anyway, they developed this, these two cardiologists developed the first monitoring for people that had just had a heart attack. It had never been done anywhere else in the world. And so there were this moving sheet of paper was going by, and there were 4 pins that were writing out their ECG, and that paper moved continuously. And then somebody might have what they call a premature ventricular beat, just an extra beat, and then the patient might have 2 or 3 in a row, and then he might have a run of them, and then he might go into what we call ventricular fibrillation, which is basically death.
Yeah.
And there was no,
That's
we
why
had
they
no,
called it a
we had no idea
defibrillator.
what was going on, because prior to that, when a person had a heart attack, they were put in a darkened room, and they're given morphine for the pain, and then a diuretic, something to make you pass more water if you're going into heart failure. And the patient was supposed to stay quiet, and the nurse would spoon feed the patient, and he'd come back a half an hour later, and the guy was dead. And he probably died of an arrhythmia. And it was Brown and McMillan, these two guys, that started wondering, why do these people die so suddenly? What are we finding out? And very quickly people saw how valuable it was, and then they started injecting antiarrhythmic drugs in the intravenous to stop these extra beats coming. And then some of the patients would go into complete heart block, and they would just die. They'd flatline. And until Brown and McMillan started monitoring these patients, nobody had any idea why they were just suddenly dead. So it was just a great breakthrough, and I was, as a lowly intern, I used to curse this machine because the pins would stick one on the other, and think, oh my gosh, you have to go down, because the nurses weren't allowed to lift the pin off. Anyway, it was just one more job, and you think, oh, and a dummy like me, I couldn't see the forest for the trees, you know, and this is groundbreaking stuff. And here I was thinking, oh, geez, I'm so tired, I have to get up again. It's the third time the machine
One more time
jammed.
to lift the pen.
Yeah, mostly was that. Sometimes a little bit more stuff, you know, and I was sort of always interested in mechanical stuff, so I was probably a little bit more...
Well, if you built your own airplane, I would think you might have been interested in mechanical stuff.
I like mechanical things, you know.
So you got to be part... So that did qualify sort of as the first heart clinic, didn't it, in Canada?
Is that what coronary care?
What I read someplace.
The first coronary care unit in the world.
Yeah. In the world, not just in Canada.
No, that's right.
In the world. Before the Mayo Clinic, before Rochester,
everybody.
before Harvard, before...
It was the first one in the world. And then a few months later, an American, I've forgotten his name now, somebody Day, I think his name was, copied it. And of course, and everybody could see how useful it was. And the Americans just took over, and they did such good work. It sort of eclipsed what was going on in Canada, because we're a small country and we didn't have a lot of research dollars. But the McMillan and Brown, they started it, and it was very interesting. And that was one of the reasons for writing this book, is that, you know, I had the story.
You think there's a whole bunch of stuff in here that you wanted to get told?
I thought should be told, yeah. And one thing was interesting for me was I would see patients that would have very interesting stories, and then they would pass on, and then those very interesting stories were lost. And I started thinking that, gee, I'm seeing a lot of interesting things too. Maybe I should write about it. But after a while, I felt I had to write about it, you know. So this book is a series of patient histories, and patient histories taken at different times in the evolution of medicine and cardiology, and how the patients are treated so much differently now as compared to when I first finished medical school. And it's very interesting, and there's so many things that have transpired. I saw lots of other interesting things, like I went to a lot of native reservations, and I always had a soft spot for the natives because my grandfather used to hire them, and I always got on really well with them, and they were always nice to me when I was a little kid. And then when you go to these reservations, you think, what are we doing, you know? And why would you move a reservation from one side of James Bay to the other side of James Bay when there's no economy up there? And quite honestly, if I lived there, I'd be sniffing gasoline too, you know? It's dumb. They've got to be exposed to the world, basically. And it's not happening. And I think the Nisga'a, you know, just recently have allowed people to sell their share. And so it's fee simple. It's the first time that's happened. And I had thought that was should have happened years ago, and it's in my book before the Nisga'a, you know, this thing came out, that they should make it fee simple. So if you live say in Nisga'a, and you think, well, geez, I don't want to live here anymore. I've been to Nisga'a 4 times now. It's only good for about 6 weeks in the summer. The rest of the time, it's terrible. From my point of view, it's terrible. You know, and there's no economy up there.
Well,
you know,
there's fishing, there's lumber, there's mining.
Yeah, the fishing's not that good now either. You know, it's right at the end of Portland Canal, you know. And I mean, there's the Salmon River, which is in the United States, but it has quite a
River.
It hasn't quite, it hasn't quite as good salmon.
Because if you go up to Canyon City or New Ange...
Yeah, but, you know, what do you want to do, though? I mean, you know, not everybody wants to fish. And fishing's only for a short time. So if you want to move down to the lower mainland, you leave everything you've ever known and owned, or not even owned, owned collectively up there. So you're trapped.
Well,
absolutely trapped.
It's interesting you should bring up the Nisga'a, because can I tell you my Nisga'a story?
Huh?
Can I tell you my Nisga'a story?
Oh, sure. Yeah.
Okay. August 2000. I'm up in Canyon City.
Yeah.
With my wife at the time and my 3 kids and my dog and my cat, having just driven back from Homer, Alaska. And we're at Harry Nice's house, he and his wife and son and daughter-in-law and so on, and we're having dinner. And we had a whole bunch of Kenai Peninsula Alaskan salmon with us. Halibut. And some smoked salmon from Kenai Peninsula. And we've shown up at Harry's place because he said, if you're ever in town, come and see us. And, of course, I just happened to drop in. So we're sitting there, and we're making just a feast like you can't believe. And we're having Alaska smoked salmon and Alaska halibut and Nass River smoked salmon. And we've got cow ribs and moose ribs. And a moose had raced our motorhome as we drove into town, which was really funny. He challenged us with male moose. Thought we were another male moose after his herd. And I hadn't seen a cow for 4 or 5 days. And I said to Harry, well, I know where the moose comes from. Where does the cow ribs come from? You know what his answer was? Costco. Because, of course, if you're in the Nass Valley up in New Ange or Canyon City, you drive down to Terrace, and they got a big Costco. And Harry's fishing boats at the McLean Dock in Prince Rupert, and it was his boat that's in the Museum of Man, his old boat that's in the Museum of Man in Ottawa. And Harry is one of the 3 people, Harry Wright and Harry Nice and Joe Gosnell, that signed the Nisga'a Treaty. Anyway, there's my Nisga'a story, and we're going to come back and we're going to talk to you a little bit more. We'll call this the end of part 2. We'll go to part 3, and I guess I'll reintroduce you.